Okay, we have seen the hospital, we have seen health insurance, but what about public health and healthcare organization? So let me invite on stage Madame Anca Del Rio, consultant data and digital health at WHO, who will explain us the use of the benefit of AI in that frame. So welcome, and the floor is yours.
Thank you. Good afternoon, everyone. Thank you so much for the kind introduction. I am Anca Del Rio. I come here on behalf of the World Health Organization, working in my role as a consultant for data evidence and digital health. By training, I'm a sociologist, health economist, and specialized in health systems innovation and digital public health. In this keynote, we will explore AI's transformative role in healthcare and in public health, focusing on precision, prevention, equity, workforce challenges, and not to mention the importance of policy and regulations to ensure AI's safe and effective implementation. The presentation structure will cover key areas addressing how AI supports healthcare transformation, use cases in clinical, operational, and public health settings, challenges, policy frameworks, and the WHO initiatives. Next slide, please, or I can try. Oh, there you go. We all know that AI is revolutionizing healthcare and population health with real-time applications. We have discussed some of the cases today. However, AI's foundational impact spans from predictive models, such as precision in diagnostics and treatment planning, disease prediction and preventative care, to operational efficacy, such as workflow automation and workforce optimization. Across several regions, AI is already transforming how care is delivered and accessed today. AI chatbots like WISA are addressing mental health gaps, particularly in resource-seeker regions. AI-powered digital twins simulate unique physiological profiles to test treatment responses virtually. In modern healthcare, one-size-fits-all treatments often fail to account for the uniqueness of individual patients or communities. AI has changed this paradigm, allowing us to deliver tailored care and focus on prevention, two pillars of effective healthcare systems. AI is a cornerstone of precision medicine, transforming how we diagnose and treat complex diseases. For example, genomics-based AI tools are predicting hereditary diseases like breast cancer. They analyze vast amounts of genetic data, identify high-risk individuals even before symptoms appear. Another application is chronic disease management. Take diabetes, for instance. AI systems can track patients' glucose level using wearable devices and provide real-time recommendations for diet, exercise, or medication adjustments. These tools are reshaping patient empowerment and ultimately self-management. In oncology, AI-based platforms like IBM Watson Health analyze genomic data and recommend personalized cancer treatments. A recent clinical trial showed that AI-recommended protocols improve survival rates by optimizing therapeutic regimens. Prevention is always better than cure, and AI is redefining how we approach it. AI models are now predicting stroke risks by analyzing wearable health data, such as blood pressure trends, heart rate variability, and physical activity patterns. This allows patients to take proactive steps long before a medical emergency arises. On a broader public health scale, AI is enabling environmental monitoring to predict and prevent air pollution-related diseases. For example, AI models analyzing satellite imagery and local environmental data can identify regions at elevated risk for respiratory diseases and guide public health interventions accordingly. These advances are not just about individual care. They are transforming public health at a systemic level, However, to scale these benefits, we need policies that prioritize accessibility and affordability. Precision medicine and prevention must not remain luxuries for high-income settings. AI must be deployed equitable across all populations. It is crucial to acknowledge the staff deficit health systems are currently facing worldwide. Here, AI already plays a key role in supporting clinical process automation, thus ensuring efficient healthcare delivery. AI does not replace workers, it supports them. For instance, radiologists, which we heard from today, now have AI assistants to analyze complex imaging faster and more accurately. And what better example to give than Professor Hügle earlier on. In parallel to the workforce automation, AI provides tremendous benefits for clinical workflow enhancement. For instance, in India, AI-powered triage systems have reduced wait times by prioritizing critical cases in busy emergency rooms. On a regulatory note, several policy guidelines recommend governments to ensure AI tools are tested rigorously for clinical reliability and workers to be trained to integrate them seamlessly into care. The WHO echoes the importance of regulating AI systems to ensure transparency and reliability. Decision support in critical care reveals AI tools like sepsis prediction models that have saved lives by alerting clinicians hours before symptoms occur. The equity-focused use case describes AI-powered health kiosks in Rwanda that provide diagnostics and teleconsultations, expanding access in rural areas. Beside the WHO, several other organizations, such as the US Government Accountability Office, released and implemented policy recommendations, asking regional governments and developers on the same hand to commit to inclusive data sets and robust oversight to prevent AI systems from reinforcing existing inequities in health. Quite an important point to mention here is also the promises and perils of AI in health. As AI represents one of the most transformative technologies of our time, with immense potential to revolutionize healthcare delivery, improve outcomes, and advance public health goals. However, we must approach this technology with both optimism and caution. On one hand, AI holds promise to bridge healthcare gaps, streamline workflows, and improve precision. On the other hand, without proper oversight, we risk exacerbating existing disparities in health access, outcomes, and equity. A key myth about AI is its perceived ability to single-handedly solve complex challenges, such as achieving net zero healthcare. In fact, there are risks that AI itself could worsen the carbon footprint of the healthcare sector. For instance, the computational power required for advanced AI tools, like quantum computing, and the environmental cost of producing and disposing of medtech devices and robotics could create a new sustainability challenge itself. There are policy solutions, though, in place, like ethical review boards, global AI certification standards, robust security protocols. In healthcare, achieving a balance is key, and leveraging AI to innovate and improve care while implementing the necessary guardrails to avoid unintended consequences. This dual approach will allow us to deliver sustainable, equitable, and effective health solutions powered by AI. AI is not a silver bullet. It is a tool. Whether it solves problems or creates new ones depends on how responsibly we design and implement and regulate it. By ensuring transparency, accountability, and inclusivity, we can maximize its benefits and minimize its risks. This principle must underpin every AI initiative, from research to deployment. Here I would like to mention a couple of initiatives that we're currently involved in the context of the Global Initiative of AI for Health, a new global initiative between the WHO, International Telecommunication Union, and World Intellectual Property Organization, that sets up a new foundation of knowledge for ensuring ethical and responsible development of AI, its regulation and evaluation. If you scan the QR codes, you can directly download the reports that have been put forward so far. And with a new release this year, these are the next 3 steps that we are currently taking in having a say in the responsible development and deployment of AI in health. Next, I would like to talk briefly about our flagship project right now, the Strategic Partners Initiative for Data and Digital Health. And start by saying that tackling these complex and diverse issues in AI for health is possible through the multilateral approach of the Strategic Partners Initiative for Data and Digital Health, which engages all relevant stakeholders, is guided by the needs of health workers and patients, examines factors such as governance, regulation, infrastructure, and the digital and health literacy of populations, and the economic and political situation in countries. Ultimately, it is underpinned by the public health values of equity, solidarity, gender, and human rights. Let us take a step back and explore how the WHO is bringing together global expertise to advance the safe and inclusive adoption of AI in health. The WHO Strategic Partners Initiative for Data and Digital Health is a flagship program, as I mentioned before, that bridges technology policy and public health shortly. It is one of the most ambitious efforts globally to date to build trust in AI, focusing on systemic challenges like workforce gaps and health equity, which have been recurring themes in this conversation today. Workforce resilience, what do we know about it and how can we actually tackle it? This is one of the topics that we are approaching as 2 of the working groups are currently working on it. We know workforce shortages are a major bottleneck in healthcare systems. However, these groups are developing AI-powered tools and comprehensive training programs to ensure healthcare workers can adapt and thrive in a digital-first environment. AI can automate repetitive tasks, freeing up healthcare workers to focus on complex patients. The initiative is also creating global standards to regulate AI systems, ensure data security, and maintain public trust. These frameworks are essentials for scaling AI ethically and globally. What sets this initiative apart is its scale and vision. Unlike many tech-driven projects that solely focus on innovation, the WHO initiative is deeply rooted in inclusivity, sustainability, and long-term impact. It unites public and private sectors, academia, and governments to ensure AI systems align with public health goals while maintaining ethical integrity. This approach builds the foundation for trust by ensuring that technology serves people, not just systems. In a world increasingly reliant on AI, the WHO Strategic Partners Initiative demonstrates how collaboration and foresight can transform health systems, ensuring they remain equitable, resilient, and ready for the future. Last but not least, I would like to talk about bridging innovation and trust, and mention the fact that the adoption and proper implementation of AI in public health and healthcare organizations requires trust in technology, including transparent algorithms, the governance system, and governments per se, as well as in more public-private partnerships, as the core of inclusive innovation. As an expert in digital public health, I see trust as foundational. Even the most advanced technology will fail without trust. Trust from patients, healthcare workers, and policymakers. The WHO efforts to foster trust includes the creation of a global consensus on ethical standards and advocating for policies that balance innovation with patient rights. AI has the potential to bridge global health divides, but only if we act together. I invite all of you, as public or private organizations, as individuals, co-workers, colleagues, to collaborate more and compete less. I invite you to follow the progress of our pioneering initiative closely and partner with the WHO in 2025, if you're interested, for the second edition of the initiative, to ensure that this technology serves every individual and community, leaving no one behind. Thank you very much.
There is any question coming? Just a question in between. So it seems like AI can do pretty much anything, right? Is there any red line that they will never cross?
I think it would never replace a human being. We must acknowledge that it's there to support us. We should embrace it while we regulate it. I think that's the way forward. Thank you for the question.
Thank you. I'm just waiting if there is any question coming up. No? Thank you. Thank you very much.
Thank you.
All right. So thank you for your patience. Thank you for your attention. Let Olivier take over. Thank you very much. Bye-bye.
Thank you very much for your presentation. One thing important, next year, the date is already booked at Genolier Innovation Hub. So please take your agenda, fix the date. We'll be there on the 5th of September for the next edition of the Building Trust in Health. If you want to take a break, have let's say lunch, please, you are welcome. You are also welcome to stay with us this afternoon for the Global Tech Summit. Thanks a lot. Merci encore.